board-certified reproductive endocrinologist, and we're happy to be there. We're happy to be involved. We take care of folks from different parts of the world. We take care of a number of international patients, and we just feel fortunate. Well, one thing also just to mention, a couple things. One of the things I always talk about to all couples I work with is ways we can optimize our natural fertility. So keeping our weight under control, eating a healthy diet, those things are important. There's pretty good data on making sure we take a multivitamin, one that's got folic acid for women, a little bit of iron, and the B vitamins is a good thing for ovulation. For men, we want to avoid toxins, want to avoid smoking, excess weight,
alcohol.
Alcohol and limitations probably okay, but going through fertility treatments, IVF, I do recommend holding off. And then, of course, medical marijuana use, drug use, want to avoid that just because it's not so great for sperm. And I'm all about getting good quality sperm, so eggs for that matter.
Well, okay, then what kind of things, like naturally, could we put into our bodies to make our bodies more susceptible for sperm and egg good stuff?
Yeah, well, I think eating more of a whole grains, whole foods type of diet, trying to get away from simple sugars. A lot of us, we hear about that, of course. Multivitamin we talked about. Antioxidants, especially when the semen analysis is low. There's pretty good data to say vitamin C and a newer antioxidant called coenzyme Q10 or CoQ10. There's some benefit for that. Of course, not taking massive doses of anything. Those are just ways of optimizing natural fertility.
Go ahead.
But another thing, if you like, we could talk about is the role for egg freezing. Who should think about egg freezing? Who shouldn't?
That's hot, right? Well, I guess maybe I shouldn't say. Well, that's the way I see it. That's like the hot thing right now is, for women who are career-driven and so forth, are getting their eggs and freezing them. And then later, so that they can kind of do whatever it is that they wanted to do first in their life, and then going back. Yeah, I want to know more about that. Is there more cutting edge? I mean, what's going on with that?
Yeah, egg freezing, it's about 4 or 5 years ago, probably about 5, 6 years ago now, the technology improved. There was a big leap. The egg, believe it or not, is the second largest cell in the body. It was difficult to freeze. We were able to optimize how we can freeze and thaw it successfully and have really high fertilization rates. So now egg freezing is a very viable option for couples, or for women, who are ideally wanting to preserve their fertility and then use them at a later date. To date, the technology seems really safe. I was asked to comment on this for another organization, and we did so because Facebook and Apple are now providing fertility coverage treatments for their workers. And interestingly, they started doing it for women considering egg freezing.
See, now that is incredible. It would be nice, and I'm speaking as a woman and as my own mind, so for those of you who don't agree, that's okay. This would be a nice benefit to have for any organization to cover any help with fertility is a love.
Yeah, no, I think, this is a bigger issue, Nicole. I did my fellowship in the D.C. area, and I sort of helped advocate, like the Cade Foundation, like Resolve National, which is another fantastic organization where we really advocate for folks struggling with fertility. But I too believe that fertility is a disease. It's a condition that we have a lot of tools that are very treatable. With egg freezing, I think it's an alternative for folks who can ideally get pregnant at a later date. We don't want folks getting pregnant too late. There's ethical issues that go along with that. But
and there's strength issues. Ask me, I know. I had my baby later in life, and he's 5 and I'm 48. Guess what? Can't run as much as you used to. But I'm working on it because, what is it? They say 40 is the new 30. Tell my body that. We're going to get ready and let's take a quick break. We're going to come back, and I want to talk more with Dr. John Norian, HRC Fertility. Google them, and we're going to come back, but we're going to give you the exact information where you